Performing range of motion exercises. Before beginning range of motion exercises, review the patient's medical record for orders and restrictions. After ensuring privacy and performing hand hygiene, introduce yourself to the patient.
Hello.
Hi.
My name's Jillian. I'm going to be doing some passive range of motion on your shoulder today.
Okay.
Before we get started, can I go ahead and see your armband?
Then identify the patient using two identifiers.
Veronica Anderson, 12363.
Okay, very good. So what we're going to be doing today is a gentle exercise motion.
Explain the procedure and assess the patient's current level of comfort using a pain scale of 0 to 10.
Can you tell me on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain ever, what you would rate your pain in your left shoulder?
It's a 0.
Okay, very good. Are you ready to get started?
I am.
Okay.
Ensure adequate light for the procedure. Raise the bed to a comfortable working height and lower the side rail nearest you. Ensure bed wheels are locked. If skin lesions or drainage are present, apply clean gloves.
Let me know if anything.
Assist the patient to a comfortable position.
We're going to go ahead and lay you completely flat here.
Performing passive range of motion exercises.
For your shoulder.
In passive range of motion exercises, the caregiver moves the patient through the full motion. Explain each exercise to the patient before performing it. Complete exercises in head-to-toe order, repeating each exercise 5 times, 2 times per day, or per healthcare provider's orders. Support the joints during each exercise. For this video, each exercise may only be shown once for demonstration purposes. Passive range of motion exercises for the shoulder. For shoulder flexion and extension, first explain the exercise to the patient.
What I want you to do for this is you're going to let me hold your arm, give me the full weight of your arm. We'll have your arm straight out with the palm down, and we'll raise it up slowly. We'll bring it behind your head and then back forward.
Okay.
I don't want you to feel any discomfort or pain.
Gotcha.
So please let me know if anything starts to hurt.
Okay.
Any questions?
No.
Okay. Let me come over
Position
here.
the patient supine with her arms at her sides, palms down on the bed, then slowly raise the patient's arm forward to a position above her head before bringing her arm back down to her side. When flexing the patient's shoulder, keep the patient's palm facing up and bring the arm up as far as the patient's natural range of motion allows. Then bring the patient's palm facing down toward the bed.
And slowly down. Is anything hurting?
No.
For shoulder abduction and adduction, first explain the exercise to the patient.
Okay.
And we're going to swing it out and up behind your head. Any questions?
No.
Are you ready?
Sounds good. Yeah.
Here we go. Again,
Position the
let me know if
patient
you have any
supine with her
discomfort.
palm facing her thigh. Then slowly move the patient's arm away from her side in a sweeping gesture parallel to the ground, with her palm facing away from her head. Return the patient's arm to her side.
Are you doing okay?
Okay. Thank you.
For horizontal shoulder adduction, explain the exercise to the patient. Position the patient with her arm extended out from her body and her palm facing up. Then move her arm up to vertical until her arm is perpendicular to her body. Bring the patient's arm slowly back out from her body, palm up, once again. For shoulder external rotation, explain the exercise to the patient.
And I'm going to use a folded towel to support under your elbow.
Okay.
I again want you to give me the full weight of your arm because I'll be doing the exercise for you.
Okay.
Position the patient with her arm at a 45-degree angle to her body and elevate her elbow.
Let me know if you start to have any pain.
Hold her forearm in one hand and stabilize her elbow with your other hand. Slowly rotate the patient's shoulder by moving her arm toward her head until her thumb is upward and lateral to the head, then return to center.
How are you feeling?
Good.
Good.
For internal rotation, the patient remains in the same position as you gently rotate her arm toward her waist. Her thumb will be turned inward and toward the back.
Forward. You're doing okay?
Yeah.
Okay. Towards
For
me.
shoulder
I'll
circumduction,
support your
explain the
wrist and
exercise
your
to the
elbow.
patient.
We're going to move your arm in a circular motion, both forwards and backwards.
Okay.
If you have any discomfort, please let me know.
Sounds good.
Are you ready to start?
Yeah.
Position the patient in a chair with her arm at her side. Grasp her wrist and support her
How's
elbow.
that feeling?
Then slowly move her arm in a complete circle.
Are you doing okay?
Good.
And
Perform the motion clockwise and counterclockwise. Passive range of motion exercises for the wrist.
on your wrist.
For wrist flexion
Go
and
ahead
extension,
bring
first
your
explain
wrist
the
up,
exercise to the patient
stabilize your elbow.
and position the
Okay,
patient
so we're gonna
supine with her arms at her
stabilize your wrist
sides.
up here.
Allow the
Be
patient's
moving your
elbow to
wrist
stay in
back
contact with the
and
mattress
forward and side
while you
to
slowly
side.
raise the
And we'll do
patient's
each
forearm
motion individually.
perpendicular to her
If
body.
you have any discomfort, let me
Support
know.
the patient's wrist with
Any
one hand
questions?
and place
Forward.
your other hand lightly over the patient's curled fingers. Bending at the wrist, slowly move the patient's hand forward
How does
toward the
that feel?
bed and backward until posterior to midline.
For this next
For wrist
exercise, we're gonna be
hyperextension,
doing some
first
range of
explain the
motion on
exercise to
your
the
wrist.
patient
Okay. I'm gonna
and
go
position
ahead
the
and
patient
bring
supine with her arms at her sides.
I'll
Allow
stabilize
the
your
patient's elbow to
Okay.
stay in contact with the
I'll
mattress
stabilize your wrist
while
up
you
here.
slowly raise the
We're gonna
patient's
be
forearm
moving your
perpendicular
wrist
to her body.
back and forward.
Support the patient's
Go ahead
wrist
and
with
get
one
started.
hand and place your other hand
Start by
lightly
moving
against
your
the
wrist
patient's
back.
palm. Bending at the wrist, slowly move the patient's hand back as far as possible without pain.
Do this 3 times.
Then return to center.
For this
For
next
wrist
exercise,
abduction
we're
and
gonna be doing
adduction,
some range
first
of motion
explain
on
the
your
exercise
wrist.
to the patient
I'm gonna go
and
ahead
position the
bring
patient supine with her arms at her
up.
sides.
I'll stabilize your
Allow the
elbow.
patient's elbow to
We're
stay in
gonna
contact with the
stabilize your
mattress
wrist up
while
here.
you slowly raise the
We're gonna be
patient's
moving your
forearm
wrist
perpendicular
back
to her
and
body.
forward, and now we're gonna go
Support
side
the
to side.
patient's arm below the wrist with one hand and grasp the patient's hand with the other. Slowly bend the patient's wrist laterally toward the fifth finger, return to center, and bend the patient's wrist medially toward the patient's thumb and return to center.
Your side. We're
Passive
gonna be
range of
doing
motion
range of motion on
exercises
your
for the
fingers.
fingers.
I'm gonna go ahead and
For
raise
finger
your
flexion
hand up.
and extension,
We'll be doing
first
any
explain
of
the
these
exercise to the
individually.
patient, and then
Each
position the patient
exercise, we'll
supine with
target
her arms
each
at her
individual
sides.
joint. And I'm gonna raise it up, and what we're gonna do is bring it forward,
Okay.
stretching each of the joints, and then we'll be moving it back, and then side to side.
Okay.
Exercise each finger individually, bending and straightening each joint.
How does that feel?
It's good.
Okay. Now I'm gonna be moving it back.
For finger hyperextension, first explain the exercise to the patient, and then position the patient supine with her arms at her sides. Slowly bend the patient's fingers back as far as possible
Side to
without
side.
pain.
Okay.
We're gonna go ahead and move your fingers side by side.
Okay.
For finger abduction and adduction, first explain the exercise to the patient, and then position the patient supine with her arms at her sides.
That's good.
Slowly spread the fingers apart and then bring them back together.
For this
Passive
next
range of motion
exercise, we're gonna do
exercises
range
for
of
the
motion
knee.
on your knee.
Okay.
I
For
will be
knee
supporting
flexion
you
and
behind your knee,
extension, first explain the exercise to the
and I will
patient,
do the entire
and then
exercise
position the
for
patient
you.
supine with her legs
If you have
straight
any
and
pain or
uncovered.
discomfort during this, please let me know.
Place
I will
one
assist you.
hand under the patient's ankle and one hand
We'll go
under
ahead
her
and get
knee.
started.
Okay.
Lift and bend the patient's knee as you bring the patient's foot in toward the body. Then extend the leg straight in the starting position.
How does that feel?
It's good.
Good.
Passive range of
Some
motion
range of motion
exercises
on
for
your
the foot and ankle.
Okay.
I will
For
support
foot
you
and ankle
behind your ankle.
dorsiflexion and plantar
We'll be
flexion,
moving your
first
foot
explain the
forward
exercise to the
and
patient,
backwards,
and then
and
position the
side to
patient
side.
supine with her
Let
legs
me know if you
straight
have
and
any
uncovered.
discomfort at all
Place one hand under the patient's ankle and slightly lift the patient's foot off of the bed. Place your other hand with your palm against the ball of the patient's foot. Press gently until the patient's toes are pointed up. Then move your hand to the top of the patient's foot and press gently until the patient's toes are pointed away from the patient's head.
One more time. Is that hurting you at all?
No, not at all.
Okay.
For ankle and foot inversion and eversion, first explain the exercise to the patient, and then position the patient supine with her legs straight and uncovered. Place one hand under the patient's ankle and slightly lift the patient's foot off of the bed. Stabilize the patient's lower leg and turn the sole of the patient's foot medially. Then turn the sole of the patient's foot laterally.
We're going to be doing some range of motion on your shoulder,
Okay.
and I'll be here to assist you.
In addition to passive range of motion exercises, patients may be directed to perform active assisted or active range of motion exercises. In active assisted range of motion exercises, the nurse minimally assists the patient or the patient minimally assists herself in moving her joints through a full motion.
Come on back, slow and steady.
For active range of motion exercises, the patient performs each exercise independently. Observe the patient as she performs each exercise.
How does that feel?
It feels good.
Come on back.
Measure joint motion as needed.
Ah, that's it.
Right there.
Okay.
Reassess the patient during the exercise and ask the patient to rate her pain on a scale of 0 to 10.
Can you give me a level of pain from 0 to 10?
0.
Good. You're going to be doing this exercise at home. So I want to go through it with you one more time.
Okay.
Ensure that your patient understands the purpose of the range of motion exercises and can demonstrate each exercise correctly.
Okay. I'm going to keep my palm facing downward,
Yes.
keep my elbow straight,
Yes.
and going slow, and taking my arm past my head.
Very good.
And then as long as I'm not feeling pain, I will continue to bring it back.
Yes. And how many times will you do this?
5.
Very good.
Use TeachBack to verify patient understanding.
Are you feeling
After
okay?
range of motion exercises are complete, help the patient to a comfortable position and place personal items at the bedside. Ensure the nurse call system is within reach, the appropriate side rails are raised, and the bed is in its lowest position.
Call if you need anything.
Okay.
And I will also be back to check on you in just a little bit.
Okay.
All right. Thank
Thank
you.
you.
Perform hand hygiene. Document patient's response and expected or unexpected outcomes.